Have you or a loved one ever had a wart that was just stubborn and didn't want to go away and kept coming back? Want to understand what is actually going on? I'm Dr. Joe Marquez. I'm a family physician. My goal in making these videos is to help increase the level of intuition people have about their bodies and their health. I have a passion for medicine and enjoy unraveling these complexities of the human body so that people can appreciate what is actually going on. I chose warts because one, it's quite common, and two, I find patients tend to appreciate having this information and knowing what's going on with their skin. So let's start. This right here is a wart. Let me change the color here so that it becomes a little more easy to see. Definitely not the prettiest of things, but essentially anywhere that there is skin, you can have a wart. It's caused by the HPV virus. But what exactly is going on here? Like, what is a wart? I think the best way to start is with the skin. So the skin, of course, is our covering of our bodies, our first layer of defense. And this portion right here, I'm trying to depict with where I'm lining. This is the outside of the skin. So that's kind of what we see when we look down in our hands and in our skin in general. But the skin has layers to it. Here you see the first layer, the more superficial portion, then a deeper, deeper, and deeper. So there's 4 layers being shown here. The superficial layer, this layer right here, this is the epidermis, which is the first, very first, most superficial layer of skin, and this is what the HPV virus actually infects. Deep to that, you have the dermis, and this is the workhorse of the skin. All your follicles, all your glands that create oils come from this portion, and of course, they go through the dermis into the outside world. Deep to the dermis, you have your what's called the hypodermis, or it's also called just the subcu fat, which is a little shorthand way of saying subcutaneous. And deep to that is your actual muscle. Now, conventionally, these 3 layers are referred to as the skin itself. And so the virus tends to infect this layer, the first layer, the epidermis, and it stays here. So that's why it's so easy for us to see warts, because it involves the superficial portion of the skin. If it was deeper, it'll be harder to see and easier to miss. If you were to actually see how that works a little bit more in detail, if you look at this drawing, very similar setup, but here we can see these little red circles are depicting virus. They're inside of this structure, which is the wart. And very important to understand is that inside of the wart, there is virus, and this is why this issue can be spread to other people. So warts are contagious because within the wart there is virus. But why do you have all this tissue around them? The main reason why that exists is because the virus is trying to defend itself from your immune system. And by cocooning itself in this tissue, it creates itself like a little silo so that the immune system doesn't know it's there and therefore doesn't try and kill it. But then by defending itself, it creates this contour on the skin that becomes the wart itself. Okay? So, like we mentioned, there is a virus in there. Specifically, it's the HPV virus, which is the human papillomavirus. When you look at this virus itself, there are over 200 serotypes, which just means 200 different flavors of the same virus. Just the DNA is a little bit different. And they infect the epithelial layer, which is just a superficial layer, and because it's the skin, specifically it's called, like we mentioned, the epidermis. Okay? And when it infects there, it creates a wart. Now, when this was first discovered, the very first one that we found, we just called it human papillomavirus 1. And this is mainly associated with plantar warts. So warts on the feet. And then human papillomavirus 2 is on the hand. So hand warts. And there's, like I said, over 200 of these. So they're there's many different kinds. But just for the sake of completeness, it's important to appreciate that number 6 and 11 cause genital warts. And so all of these cause warts that are benign by nature. And what that means is they're all masses. So all these warts, of course, are masses. But the virus, when it infects the tissues, does not tend to give those cells the ability to one day potentially leave the site of infection. So if you have the wart on your hand or on your foot, it doesn't invade and go one into deeper tissues or two just into distal tissues. So if the infection is in your hand, it doesn't go into your muscle, it doesn't go into your bloodstream, it doesn't go to your liver, for example. And because it can't go anywhere, or it doesn't get that ability through this infection, it's a benign infection. But as many of you probably know, this HPV virus is associated with some cancers that are malignant. Those, in particular, typically are different viruses of the HPV group, specifically 16, 18, 31, 33, 45, 52, and 58. Now, the numbers themselves aren't super important, but when you really want to go and figure out if a patient has an increased risk of getting a cancer, it is important to try and figure out what they are. Now, these viruses down here with the increased cancer risk, these are associated typically with cervical cancer, which is the tissue. The cervix is a tissue within the female reproductive tract, specifically where the vagina and the uterus meet. This is the tissue that has to dilate in order for a baby to go through during childbirth. So these viruses here, 16, 18, 31, 33, 45, 52, and 58, these have a higher chance that the infected tissue can not only become infected with the virus, but can develop the ability to actually grow, and after growing, go into neighboring structures and spread. And because of that, there is a malignant potential with these viruses. This is literally why women get pap smears every so often, to one, determine, do the cells look normal? Are they showing signs of alterations? And do they have the HPV virus? These higher risk ones in particular, are these present? Because if they are, the combination of how the cells look like under a microscope and the presence of this virus dictates what we do next. And because of the cancer risk, these viruses right here, there is a vaccination that was developed. It's called Gardasil. And it's Gardasil 9 because it is designed to help protect you against these 9 viruses, or serotypes, types of HPV. Before there was Gardasil 4 that primarily just defended you against these 4 right there. So the 2 that cause genital warts, again, benign, they tend to not have any malignant potential. But the HPV 16, 18, 31, 33, 45, 52, and 58 do have some malignant potential. And so vaccination against those actually decrease the risk of developing cancer. But I just wanted to make sure that we understand, today we're talking about warts on the skin. So we're not going to be really dealing much with these in the bottom here that cause cancer, but mainly on these on top that just cause the warts, which are just benign masses. Okay, just benign growths. Now that we understand that, it's another thing to what's important to really appreciate is who is at risk for getting warts. And one that is very common are those that have macerated hands. And what that means is hand moisture that is just so moist, it begins to degrade the integrity of the skin and its ability to actually be a defensive layer for you. And this is most common with meat handlers. Now, the moisture itself doesn't necessarily cause the virus to come in, but it weakens your defenses. And so if you come in contact with the virus, now your weakened skin is more prone for the infection. And so the handling of meats here tends to cause that maceration, especially if you don't wear gloves, of course. And if the meat is infected with HPV, then that can transfer into you, and then you get the hand warts. So that's one risk factor. 2 is walking barefoot. And it's kind of the same idea. You get trauma to your feet because they're bare, and if you come in contact with the virus, the skin is compromised, higher chances of that infection happening. Then you have nail biters, similar idea. And then sexual contact. So we kind of already alluded to this with cervical cancer, of course, and genital warts, but technically the most common sexually transmitted disease, or STD, is HPV. Essentially anything that has skin-on-skin contact, whether it's sex or just touching hands or sharing things like beauty supplies for like nail clipper, can spread the actual virus from one person to the next. Another risk factor is immunocompromised patients. This means patients who have just a little bit of a weakened immune system. Like I mentioned before, the purpose why the virus creates this cocoon of tissue around it is to defend itself from the immune system, to hide from the immune system. Now, if the patient's immune system is already weakened for one reason or another, then that person already has a higher risk for the infection, for the wart to actually grow. Whether that is they have just a genetic issue that caused them to have a weakened immune system, or they had some kind of transplant, whether it was a kidney or whatever, and because of that have to go on medication that will weaken their immune system. For whatever reason, if the patient is immunocompromised, we have found that they have a higher risk of getting warts. Now, there was a study that I read that specifically with renal transplant patients, these patients, of course, were on immunosuppressive medications so that their immune system doesn't reject that new organ. And by weakening the immune system for the purpose of keeping the organ longer, these patients, unfortunately, had a 90% risk of developing warts. It doesn't mean every single time, but just this one particular study showed that high of a number, and it kind of just depicts the fact that the immune system is such a crucial portion of keeping warts under control. And one more that kind of also goes along the same theme is eczema. Eczema just is a condition where the skin gets too porous. It's commonly associated with allergies and asthma, for example. But because the skin is so porous, it has a hard time keeping the water within the body in the body until the water escapes. As the water escapes, the skin gets dry. As the skin gets dry, it gets itchy. And then as the skin gets dry and itchy with you scratching it, it becomes more and more porous into kind of like that vicious cycle. And because it's porous to the point that water can get out, it's porous to allow a virus to get in. Okay, so in all of these cases, it's either an issue with the skin not being as, the integrity of the skin not being as full as it should, and then two, the immune system being a little bit weakened. Okay, now this word in the bottom here, this phrase, incubation period here, what this is referring to is the time required from when you encounter the virus to when you show symptoms, in this case, a wart. And typically for HPV to cause a wart, it takes about 2 to 6 months. So if you were to come in contact with this virus, and for one reason or another, your skin and your immune system in general was not able to keep it in check, in roughly about 2 to 6 months, is when we will expect that wart to actually appear. So it doesn't appear immediately. And when that wart appears, you came in contact with that virus months ago. Okay? Now, the next thing, now that we have more of a grasp about the anatomy of the skin and a little more comfortable with the virus itself and how it works, we have to now be more specific with our diagnosis, right? How do we know a wart is actually a wart and not something else? Because obviously, not every growth that is on the skin is a wart. And the best way that, at least I think about it, and most doctors think this way, is we look at the same thing from two different perspectives. One is, how do we know the thing that we think it is actually that thing? And then two, can we prove to ourselves that it is not other things that it could be? All right. And so when I think of characteristics for warts, there are many kinds, but for simplicity's sake, I definitely have three that always kind of run through my mind. One is, it's usually almost always flesh colored. So whatever the color of the flesh around the wart will be roughly the same color. Skin lines, so your skin naturally has these lines in them. As those lines go from the skin onto the wart, they are disrupted. Now, we'll see some pictures in a little bit to kind of show this a little bit better. But skin line disruptions or skin lines being disrupted is a common feature with warts. And third is this phenomenon called thrombosed capillaries. And the theory behind this is that the virus is causing the growth of this tissue so quickly that the blood that is required to feed that tissue can't keep up. And the blood vessels that are made rapidly try and feed this growing tissue are so fragile that they actually burst. And as they burst, you have these little black dots in the wart that kind of show you that these capillaries are bursting. So it's almost like a small bruise within the actual wart. And seeing these bruises or these thrombosed capillaries is a very characteristic sign. If these are present, it kind of tells us positively or supports the fact that you actually have a wart. But we have to also look at it from the other perspective in terms of what else could it be and help us be more confident that it is not those things. That can also further support our diagnosis. And typically for me, the things I always kind of look for whenever I'm thinking about warts is making sure we're not dealing with a corn, we are not dealing with a skin tag, we are not dealing with trauma. And just in generality, I always kind of make sure that we're not dealing with skin cancer. Now, luckily, skin cancer typically doesn't look too much like a wart, but in some cases, some can just be very weird and it can look like it. Okay, so here's the same wart we had initially, and here we can see a lot of the characteristics we were talking about. One, you can see all these little black dots everywhere. Those are the thrombosed capillaries that I was talking about, because this growth happened so quick that the blood vessels couldn't keep up, and so they were too fragile, broke, bled. The bruising is what we actually see, these small little bruising events that kind of support that this is actually a wart, very characteristic of a wart. Two, like we mentioned, is flesh color. So if you look at this flesh, it's roughly the same color. Three is the lines, these skin lines that we can see in the body. Now, of course, on this side, we can't really see too well, but we can definitely see this one right here, it looks like. And when you go onto the wart, it kind of goes away. It doesn't continue onto the wart. The wart distorts them, and that's, again, very characteristic of a wart. So when you look at this, this patient's skin findings, it makes me more secure that we are actually dealing with a wart and it's not something else. And looking at those other things, here's a corn. If we zoom in here a little bit, we can see it is skin colored for sure. So that is a common characteristic between corns and warts. But when you look at the skin lines here, they definitely go onto the actual lesion. And so that makes it less likely to be a wart. And in two, you don't see any kind of thrombosed capillaries. Now, in some cases, you have to pare it down, and what paring means is just getting some kind of like pumice stone or nail file or something to just kind of shave this down a little bit. And as you shave it down, you uncover those thrombosed capillaries. But here you can see a little part here in the middle chunk part missing, and you don't really see anything in there. And assuming you pare it down some more, if you don't see it, it kind of makes this unlikely to be a wart. And what makes a corn is actually pressure. This is not caused by a virus. There's no virus living deep in the skin in this patient. It's just the way this person's posture on their foot is putting too much pressure with each step in here. And in order for the skin to defend itself, it's getting thickened and thickened and thickened, just to kind of relieve itself of that extra pressure that's causing damage in here. Okay. Then comes what's called a hypertrophic scar. Now, what this just means is the person got a little cut here, and for one reason or another, this person's immune system was a little bit too overzealous and created too much scar tissue, and it kind of made this thick scar. Now, if they tell you, yeah, I had a cut here time ago, whether it's months, years, then that might make it easy. But I've definitely had cases where patients come in with a scar, and they can't remember whether they have dementia or it's been just a long time. It might be in a part of the body that they don't really see every single day, and so they can't really remember how long it's even been there. But when you look at this, one, there is no thrombosed capillaries. When you feel it, it'll feel different, and you see the skin lines are persist inside. So those are preserved, and with that, especially if they have a history of trauma, it makes this clear this is not a wart, but in fact, it's just a hypertrophic scar. And here's a skin tag. And with the skin tag, similarly, it is flesh colored. You do see the skin lines going into it, no thrombosed capillaries, and when you just look at it, it pretty much just looks like just a little extra skin in this region with like a little stalk. And so the treatment for this will be very different, and this is not a wart. But now with treatment, because this is always the big question is, should we treat? And the quick answer is not always. It depends. I always tell my patients that if you do nothing, a certain percentage of these warts will resolve on their own. It just takes time for your immune system to actually uncover the wart and then take care of it. But it's a numbers game. That 50% of kids in 1 year had their wart resolved. And in that same study, in 2 years, they had 65% had resolution of their warts. But again, this is kids, and with adults, numbers aren't as clear cut. They're not as good, I should say. They're a little bit lower. But again, this is no treatment. They were just essentially looking at the wart for that year or two, and just by doing nothing, the wart resolved roughly half to maybe a little bit over half the time just on their own. Okay? But of course, some patients just don't want to wait that long, whether it's a cosmetic thing, it just looks weird, or in some cases, that could be causing some symptoms, getting stuck on clothing, or might be bothering them. They might choose to say, I would like to treat it faster. And if we treat, what I always kind of make sure they understand is that there is no silver bullet here. The key is persistence and consistency, because warts are a tricky situation. What I tell patients is that with treatment, is just a shorthand for treatment there, TX, about 25 to 40% of patients have resolution in 12 weeks. Now, this study, because they're actually treating patients, they tend to have higher, more resistant warts. So I always tell patients to take it with a grain of salt, because this includes warts that are just very stubborn, more stubborn than your average wart. But again, it's a number for them to appreciate, and just to really understand that this is a game of patience, unfortunately, and just see how your body responds. But with the management, the most common treatment plans that I have is that we have, I should say, is salicylic acid. And with salicylic acid, also called compound W, this destroys keratin. And so when we're talking about that virus affecting the very first layer of your skin, the epidermis isn't truly actually just one layer, it's multiple layers in of itself. But one important portion of the epidermis is the very top part of it is keratin, which is a protein. And the purpose of this protein is to make your skin waterproof, and it kind of gives the integrity of your skin. And this medication here, the salicylic acid breaks down that keratin and essentially begins to break down the actual wart. And that's the key to all the treatment for wart, is we're literally trying to damage the wart, to destroy the tissue so that it will fall off eventually. And our hope is that once it falls out and your immune system comes to essentially heal the damage that we have done, it finds the virus inside of it and it kills it. And this is a thing that's also kind of frustrating, is that it's very possible that this treatment works as far as kills the wart. The wart falls, the wart is gone. But if your immune system is not able to eradicate or just get rid of the virus, there's a good chance it might come back in the future. Okay, so it's a two-pronged attack, or two-pronged hope, is to first destroy the wart, and then two, hopefully your immune system comes in and kills the virus as well. Okay, now this salicylic acid, though, like I mentioned, it just kind of burrows a hole into the outer layer and damages the actual wart. And typically it's a four-pronged attack. The first is just doing some warm soaks of the hand. This can be 10, 15, 20 minutes. It's just meant to kind of soften the skin, make it a little bit more malleable. Then you're going to use something, either a pumice stone is typical, or in some cases you can use a nail file, and you want to just pare down the wart, kind of shave things down. So you first put about 10 to 15 minutes of a warm soak, maybe some Epsom salt in there. Then you want to file down the wart a little bit. Again, the same idea, same theme, is just damaging the tissue. Then, after that, We then use the salicylic acid and just pour just a little bit over that pared down wart that we just did. And the last is actually some duct tape. So typically I just have patients do warm soaks, I should say, pumice stone, pare down that the wart, put in some salicylic acid on top of that, and then cover that with some duct tape. And the duct tape adhesive is also abrasive and can damage the wart. And then you go to sleep. You wake up the next day, take it all off, go to work, go to school, go to life. You come back the next night, rinse and repeat. Soaks. You then put the pumice stone on it, pare it down, salicylic acid, and duct tape. Do it every single day. But what's important though is that you are irritating the skin. And by irritating the skin, sometimes it gets a little bit too red, it gets a little bit too angry. And if it becomes a little bit too sensitive, too sore the next day, take a day off, let it heal, and then once it recovers, do it again. But it's persistence. And remember, our goal essentially is 12 weeks. So 3 months or so of as many days as we possibly can. And typically after a handful of weeks, if it's not getting better at all, especially, we then can do some cryotherapy. And it's not you switch from the first to the other, you combine them. So you continue doing those same 4 steps, but now we add some cryotherapy, which is just some liquid nitrogen spray that we put onto the wart. Again, meant to kind of damage the tissue a little bit. Same principle. We continue doing that. And typically, from my experience, this works pretty well. Talk to your doctor, make sure it's the proper diagnosis, start on this kind of treatment. But there are definitely cases where this treatment by itself is just not sufficient. There's just very stubborn warts out there. And in those cases, there are other treatment plans that we can do, but these are a little bit more exotic. Number 3 is Candida antigen. So Candida is a type of fungus, and you give the antigen of that. And antigen, by definition, is anything that just stimulates your immune system. So in this case, it's the portion of this fungus that causes your immune system to get angry and attack it. And again, it's the same principle, right? You want to attack the actual tissue. But understand, we're not giving the actual fungus itself. It's similar to, if you have a car, you're not giving the entire car, you're just giving the door of the car, a portion of the car. And this can be injected. What's unique and nice about this treatment course is that with the other ones, with the cryotherapy portion and with all these steps, is you have to attack each wart independently. So if you have 5 warts, 5 different places of duct tape with salicylic acid and soaks and pumice stone pairing. But with the Candida injections, you inject it, and the one injection can help and benefit more distal warts. So warts are other parts of the body. So it's more of a systemic response, which has its positives there. And the last couple of things that we can do are just more immune modulators. These are medications that help beef up your immune system and make it respond differently. Again, that's probably the most important player here is your immune system, because that's the only thing that we have that actually attacks the virus. Nothing else that we do for these HPV warts actually attack the virus besides your immune system. And then the 5th one is phototherapy, where they just shoot special rays of light that again damage the skin, stimulate the immune system, and try and get to the bottom cause here. And this is kind of how our treatment plan is for warts. So it's important to understand the rates of, if we do nothing, for adults is a little bit worse. And if we do something more proactive, the rates, however they are, it takes us months to really be able to determine how stubborn your wart actually is. And these 2 steps are the kinds that, probably the most common treatment courses that I do with my patients. And these are a little bit more like back pocket in case we're dealing with more stubborn warts. Probably the last and most important step too in general is prevention. I always tell my patients it's very important to appreciate the fact that an ounce of prevention is worth a pound of cure. Okay? And with this issue, the thing that to really avoid is no barefoot walking. Now, there are some benefit with barefoot walking, but it's all just the pros and the cons, benefits versus risks of it. And if you're a person who's more prone to warts, more concerned with having warts, especially on your feet, avoiding that is key. Another one that is very crucial that I always tell my patients is no sharing of parent objects, whether that's a pumice stone, a nail file, whatever. Do not share it. Make sure it's labeled, put away, and everyone understands that this is for the wart and nothing else, because if they use it, they could transfer the virus to themselves, okay? Remember, the wart itself is full of virus particles inside of it. Wearing gloves, especially if you're dealing with moist things that could potentially be infected, that the gloves provide that layer of defense. Eczema management. If you have eczema, making sure you're using your emollients, moisturizing your skin, make it as healthy as possible so it can be that protective barrier that we all want. No nail biting. Just you don't want to weaken your skin and weaken your cuticles and allow that to be the site of access for the virus. And probably the one that is most underappreciated, maximize your immune system. And easier said than done, but the things to really focus on is eating right, regular exercise, sleeping well, and managing stress. Again, easier said than done for most of them, and these can each honestly be a whole discussion in of themselves. In my Instagram page, I actually mentioned a little post about sleeping well and the importance of sleeping, and how one of the consequences of not having good sleep is actually a weakened immune system. So definitely something I always kind of focus with my patients, and making sure that we're not ignoring this step and we're trying to be as proactive as we can. But again, in summary, warts, we have to be realistic with these, and persistence is key. Sometimes your immune system handles them very well, and it's not really a problem. By the time you see the doctor for the wart, it's gone. And sometimes, though, your immune system needs a little bit more help. So it's important and key to communicate with your doctor and just work together. But that's pretty much it about this discussion. I hope you found this information helpful. I'll see you guys next time.